Hey guys, so today I'm here to talk to you guys about pain. I have so many patients that have had or are contemplating knee replacements and or hip replacements. Some people have both, some people have four. In addition to all the other aches and pains. Or they just deal with chronic knee pain and they don't want to have a knee replacement because it's scary, and so they're dealing with chronic pain and they can't work out, they can't get around, so they're more sedentary, which has a ripple effect on your health, which is unfortunate because if you do acupuncture and you combine that with taking care of whatever structural imbalance is happening that causes that pain, the pain will dissipate. Normally when you have joints, like your knee joints, they should track and it should be fine, but when one side is too tight and one side coming in is weak, then it ends up not sitting properly. And then when you're using it, it's wearing out all of that good cushions and fluids that are in there that make it all juicy can completely go away. You wear it off because you're rubbing sort of bone on bone because it's not tracking properly, it's not sitting properly. And then once you start wearing the bone, then the bones get all jaggedy and pain increases, and then you have no choice but to have a knee replacement. So if you do the work and you do the acupuncture, you should be able to save all of your joints and they should be able to function for you properly for your lifetime. And so what I'm going to do today is use my foam roller and show you some of the things that I do that I find are problem areas for people with knee and hip pain. And so you can get these anywhere. I'm putting a link below so you can just click through and buy one for yourself. This one is great for portability, and it has a little bit of this grid on it so that it digs in a little bit more, so it's a little bit more aggressive. And then I have one that I use at home that's a 36-inch and it's smooth that you can use for a lot more things. But this is great for portability. So I'm going to use these. So the first thing that we want to look at is that your quads here tend to get tight. If you run, walk, especially spinning or cycling of any kind, it makes your quads tight. But I think the biggest reason people have tight quads nowadays is the more you sit, the tighter your quads and your hip flexors get. And then that impacts how everything else sits. Your pelvis, you get low back pain, you get knee pain, you get hip pain. And so to release the quads is one of the best things that you can do. And so how you would do that is you would come face down. You never want to roll on your kneecap, so you want to start above. And so this up a little bit. So you can just roll back and forth. Now, if it's really painful for you, keep this toe on the ground. It's a little bit of cheating, keeping that toe on the ground. You don't feel this digging in so much when your toe is on the ground. So if it's really painful, start there and then get to where you point your toe and you can roll on that. And then when you get to one of those spots that's really painful, one of those sticky spots, you might feel it digging in a little bit, but you get to a certain space and it's really painful, like, whew, take your breath away painful. Usually that's where the fascia is stuck to the muscle. And so you really want to release that so that everything works independently and the muscles can stretch and you can have more mobility and flexibility. And the knee and the hip will work properly. So when you get on a place like that, you want to pin that fascia down and then move the joint. So you can just roll. When you find the sticky spot, bend and straighten. And if you do that every day for a few minutes, then that should release all the tension in the quads and you're going to have much more flexibility and mobility. The knee is going to sit a little bit better, the the hips are gonna sit better, your pelvis is gonna sit better, and you're gonna have a lot less pain. And so it's super easy to do. You don't need a ton of equipment. You don't need to go to the gym. You can sit on the floor in front of your TV rather than sitting on the couch and watching your program. Get on the floor and get your foam roller and do these exercises while you watch your TV. Sitting on the couch has a whole nother level of health implications. So getting on the floor while you watch your program is much better. So the IT band, which goes from the knee to the hip, is a really thick connective tissue band that tends to get really tight. Sitting is great for it, cycling, running, a lot of things are going to tighten it up. And so rolling to loosen that up. And again, if you have to leave your foot on the floor because it's just too painful, you can do that. And then once you work out a lot of the tension, try holding that foot up and rolling. And again, when you get to a spot that is really painful, where you get one of those sticky spots, stop and just move that leg back and forth, and it'll help to release that. And if you do this just 5-10 minutes every night while you're watching your program, you'll totally open all of this up. You'll have much less pain, more flexibility, your knees will start to feel better, your hips will start to feel better. So if you don't have a foam roller, like I said, below I'm going to put a link so you can get a short foam roller that is a grid, or a long foam roller that's 36 inches that I'll cover some more ways to use that at home. So I'll have the link below so you can purchase both of those. And so let's see if rolling out those quads, rolling out that IT band doesn't help you with your knee and hip pain. And then just keep coming back, subscribe to the channel. I'm going to be doing some more videos with physical therapy with the foam roller, with lacrosse ball. We're going to be working on shin splints, tightness here, tightness in the calves that are relate to Achilles tendonitis, that relate to plantar fasciitis, and working on ankle mobility. Because all of this, it's all connected. You step from your foot up. So if the feet are off, the arches are off, the Achilles, the knees, the hips, the back, everything gets to be off. It's all connected. So we'll work on different body parts, but today let's just start with trying to release those quads and the IT band with the foam roller. 5-10 minutes every night. Leave me a comment and let me know how you do, or if you have any questions. And again, subscribe to the channel so you don't miss the upcoming videos. Until next time, stay well.